Hi, I'm Dr. Kyla, paediatric dietitian, fussy eating specialist, and mum of two. I'm the founder of the online Mealtimes memberships that help parents just like you experience a confident and guilt-free way of feeding children. I'm also a business owner, a hot cross bun lover, and my superpower is finding things that you cannot live without. In this podcast, I'm talking about feeding your family, along with a random selection of topics that tickle my fancy. Welcome to Mealtimes with Dr. Kyla.
Hello and welcome to today's episode of Mealtimes with Dr. Kyla. Today I'm answering the question, does my child need their iron tested? Before I get into that, I just want to tell you about a recent masterclass that I ran with Rachel Wilson, paediatric dietitian, all about BMI in kids. So this is for anybody who's been to the 2-year, the 4-year check and has been told that their child's BMI is outside the normal range. Perhaps it's too low or it's too high, and they've been kind of just panicking about that since. Or perhaps it hasn't even been a panic. It's just been this kind of niggling worry that crops up every time their child maybe eats more, eats less. It's really just this worry. I would love to tell you more about that. I've popped the link in the show notes. You can purchase the replay now. The feedback from participants was that it was so reassuring and like a big breath of fresh air. So I would love you to check that out if it's relevant to you. Okay, so let's get into today's episode. We are talking all about iron. There are so many things that I could talk about when it comes to iron. It is one of the big focuses as a dietitian in childhood, as one of the key nutrients, front of mind for me in childhood. So we're always conscious of a mum's iron levels in pregnancy because that's what sets up the baby's iron stores. And one of the key reasons that we start solids is because of iron or increased iron requirements at around that 6-month mark. Now, you know that I do not like fear-mongering around health. It is not something that I'm going to be panicking you about, but it is one of these nutrients that I do think needs some attention. So, what even is it? What is iron? Iron's a mineral that the body needs for growth and development, so it's particularly important in childhood. It is essential to red blood cells for transporting oxygen to cells, and without enough iron in the diet, there's a risk of deficiency, and this is where we start to see some side effects that really impact a child's life. Now, the latest evidence from actually a West Australian research trial, the Origin study, suggests that a third of 1-year-olds and almost 60% of 3-year-olds have low iron. That is quite a lot more than any of us would estimate, and that's based on blood tests that the children in the sample had done. But it's one of the things that prompted this podcast. Now, I'm not sure why this is happening. Nobody is sure why it's happening. I'm going to talk a little bit more about food and the relationship there. I actually don't think it's a lot about what kids are eating, but it is an area for ongoing research. So let's talk about what actually causes low iron. Why might your child be low in iron? The big one, and the one that we tend to opt to as a first step, is a low intake of iron-rich foods. So if we're thinking about iron-rich foods, they are foods, often protein foods, apart from dairy. So think about anything from your red meat, your beef and your lamb, to chicken, pork, fish, nuts, seeds, lentils, legumes, kind of those real protein foods often have the sources of iron. They also include iron fortified, often cereals, so things like Wheat Bix that have iron added to them. Now, having a low intake of iron-rich foods can be quite common, particularly in the toddler years. You know, those who are in a fussy phase right now, or perhaps some older kids who have found it really hard to learn to like a wide variety of foods. The high iron foods are some of the harder, trickier foods to learn to like. And so it might be that your child just really struggles to eat iron-rich foods. And so that can be a really common contributor to low iron levels in the body. Having said that, there are a lot of kids being flagged with low iron who eat a really normal, reasonable amount of food and of iron-rich foods, and we're still seeing this happen. So what else might be going on? We know that during childhood and periods of big growth, that iron requirements are quite high. So it can be really tricky to match that need with what a child is able to consume, particularly at an age where they are so busy. They're on the go all the time. They're really not wanting to sit and pay attention at meals for a long period of time and eat a lot of chewy, long foods that take a long time to eat. There can also be associated with really big intakes of cow's milk. Now, I'm talking kind of 600 mils plus in a day. We know that the more cow's milk you have above that, the more that you can impact iron levels. It makes it really hard for the iron to be absorbed. It starts to compete with the calcium. This is really not a problem at lower levels of cow's milk, but it is something worth considering if this happens for your child. And I just want to say that often, if your child is having a large amount of cow's milk, it is often for a reason. Things have been really tricky. It's been one of the only things you can fall back on. Perhaps their behaviors feels really challenging. They're asking for milk all the time. And that is absolutely something we can help with. But I just want to flag that there. We know that there can be some issues for some kids with absorption of iron, and that can be to do with potential undiagnosed celiac disease. There can be some other reasons that they might not be absorbing that as they should. We also know that for a lot of kids, there's a hereditary link with low iron. So if you are a person who also has low iron, there's a high chance that your child genetically is going to be predisposed to having lower iron levels in their body. Or perhaps when you were pregnant, if your iron levels were low, it makes it really tricky for a baby to have enough stores to get them through to that 6 month mark. Now, that is not your fault. It is clearly absolutely nothing to do with you doing the wrong thing. It is something that absolutely happened with me. I had an iron infusion later in pregnancy, but my levels were really low. And so the chances for my youngest child in particular of having had enough iron to get her through is probably reasonably low. So thinking about that, it's a really hard thing to catch up from. If you start with low iron levels, it's really hard to replenish them in childhood when you're also growing. So there are quite a few reasons, and that's not even all of them. But what would you look for in your kid if you think maybe they are potentially low in iron? This is where it gets kind of gnarly. So, symptoms include things like tiredness and lethargy, but I would also say that a lot of our clients with iron deficiency actually present with almost excessive energy levels. These are kids that you would describe as an energizer bunny or the engine that never stops. It can look on the flip side of the coin, more like falling asleep in the daytime if they don't usually need a day sleep, regularly falling asleep in the car if that's not normal for them. But then again, it can also include things like regular night waking, night terrors, difficulty getting to sleep. And those things can play into each other. Are they falling asleep in the day because they're, waking up at night? Is the waking up at night related to the iron, or is it something else? Is it to do with those 3-year-old night terrors that often come? There's so much going on. And a lot of these symptoms are really contradictory, which makes it really hard for you to know what's going on. We can also predict that kids with low iron will get sick more often because of the impact of iron on their immune system. We can often see kind of pale skin, dark circles under the eyes. There can be a case of eating things that aren't food, which is a condition called pica, and that's related to low iron levels. We can also see low appetite. And this one is so tricky because a lack of appetite actually makes it impossible to get enough iron from food, which creates quite the cycle. You have a low appetite, you don't want to eat, you eat less iron-rich foods, your iron levels go down, which reduces your appetite or increases the lack of appetite, meaning that you're eating less high iron foods, and so the cycle continues. Yeah. Anyway, you're probably thinking like, some of these symptoms are kind of generic, like they're tired or they're awake. It could be anything, and you would be 100% right. Also, a lot of the kids that we work with in our one-to-one appointments have no symptoms. So it is a really difficult thing to work out. And that brings me to the question of the podcast. Does your child need to have their iron levels tested? Because the only way that we can accurately know if your child is low in iron is to have a blood test. And so when we look at the levels of iron in the blood, specifically the ferritin levels, we can understand more about where your child's level is at and then what kind of treatment they might need, if any. You absolutely cannot tell iron levels from anything else, not an eye test, a hair test, or anything else. And it really bothers me how many people are being told that their child's iron is low from some of these wacky kind of ways of testing that have absolutely no evidence to support them. And this is really actually important because you can have too much iron. So we absolutely never want to treat iron, low levels of iron, without knowing exactly what they are. So, when is a blood test indicated? Well, this is something that I would really encourage you to take to your GP. You will need a referral if you're going to get a blood test done, but this is the only way that we can test for iron levels. So, when you go into this appointment, I want you to be thinking about have they got any risk factors for low iron or any of the symptoms, and I'd be chatting that through with your GP and following their advice. But what I don't want you to be worried about is the actual blood test. Like, this should not be the thing that is stopping you. Absolutely, it is not a fun thing to do as a family. It's often nowhere near what you've hyped up in your head, though. So, this is actually a topic of discussion in the family mealtimes group recently. And there was a mum asking for advice. She was taking her child in to get a blood test and what were the practical strategies. And we have a whole lot of support with this in the membership, but members came in with their own experiences and a lot of reassurance. And the mum came back and said, actually, that was a lot easier than both of us expected when we were prepared. So there's lots of support in the Mealtimes membership if this is something that's coming up for you too. Personally, I found that they're always much better. Blood tests with kids are much better than I expected. I appreciate that there are a lot of people who have had tricky experiences, but I really don't want that to be the thing that's stopping us getting a blood test for iron levels, because low iron in childhood can have really significant impacts on growth and development. Okay, so if you do go to the blood test, we can support you with that. The first thing that we're looking for in the results is the ferritin levels. And this tells us about your child's iron stores and helps us to decide on an appropriate treatment. And as I was saying before, this is super important because in children, we do not use random or generic doses of iron. It has to match that child's body size and how deficient they are. So if we were to give them too much iron because we didn't know what their actual stores were, there's real risk in that too. So it's really important that we understand exactly what those levels are and what that looks like for the kids. Now, that is on its own a topic for another day and something that you can find in the Mealtimes membership. But this is probably unlikely to be the last blood test that you'll need to do in this process. And so sometimes hyping yourself up or getting prepared for that is helpful, because we need to know that the treatment is actually working. And so usually once we've started a supplement at a particular level, the GP will recommend retesting after about 3 months of being on the supplement, because we want to see that it's working. We need to see those iron stores going up considerably to know that we're on exactly where we need to be. And I I know that that's really tricky. We are due our 3 month blood test 3 months ago now. So life does get in the way. I have, as a result of my podcast, prompted myself to book in with the GP and get the referral for the next blood test to check on my youngest's iron levels. So if that's you, I just want to remind you that that is something that you will need to do. Also, on the topic of dosage, which again is a topic for another day, it's something that we address a lot in the Mealtimes membership or with almost all of our one-on-one clients that we see. But actually, most of those kids are on a dosage of iron that is wildly less than what they need to successfully treat the deficiency. And that basically means that they will have to be on an iron supplement for so much longer than necessary because we're not treating at an appropriate level. So, one of the ones, I mean, some of the girls on my team see just iron consults where they're actually really looking at why is it so tricky to get this iron up? Is there anything else going on? Are we on the right levels of dosage? How can we help your kids willingly take it? There are a lot of strategies around that. So, please do get the retest, because if your child's ferritin levels have only gone up a couple of numbers, it's really important that we review and work out why. So, To finish up, does your child need to get their iron tested? What have you taken away from what I've said here? Does it apply to you, or are you actually thinking, no, we're fine? Let me know if you found this helpful, and if you did, you'll love the extra information and the daily support from me and my team inside the Mealtimes membership. We can answer questions about iron-rich foods, how to help your child like them, treatment for iron deficiency, and how to help your child willingly take the iron supplement. You can also access my iron masterclass to watch whenever you like. Plus, members get a discount on one-on-one consults with my team. Bring your worries, swap it for a sense of confidence and a clear next step. Thanks for being here today.
A huge thanks for tuning in and listening to my podcast. This is all brand new for me, so I'd love to hear your feedback. Give me a review or send me a DM. I'd love to hear your thoughts. And above all, I'd really love you to hit that subscribe button to keep listening. Thanks.